How to low blood pressure. 1. What is blood pressure? High blood pressure, hypertension, is known as the silent killer. It frequently has no symptoms but poses a significant risk of heart disease and stroke. These illnesses are also among the leading causes of death. The measurement of your blood pressure is in millimeters of mercury, abbreviated as mmHg. The measurement is comprised of two numbers. A. Systolic blood pressure. The top number represents the force of the pressure created by your heart as it pushes blood into the arteries throughout your body. B. Diastolic blood pressure. The pressure in your blood vessels between beats, when your heart is filling and relaxing, is represented by the bottom number. Your blood pressure is determined by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. Your blood pressure rises as your arteries narrow. A blood pressure reading of less than 120/80ths of a millimeter Hg is considered normal. A blood pressure of 130/80ths of a millimeter Hg or higher is considered high. If your numbers are higher than normal but less than 130/80ths of a millimeter Hg, you have elevated blood pressure. This indicates that you are at risk of developing high blood pressure. The good news about high blood pressure is that you can make changes to significantly lower your numbers and risk without taking medications. Here are effective methods for lowering your blood pressure. A. Increase physical activity and exercise. According to a meta-analysis of 65 studies, aerobic and resistance exercise can significantly lower blood pressure, particularly in men. Sedentary older adults who participated in aerobic exercise training reduced their blood pressure by an average of 3.9% systolic and 4.5% diastolic in a 2013 study. These outcomes are comparable to some blood pressure medications. As you increase your heart and breathing rates on a regular basis, your heart becomes stronger and pumps with less effort. This reduces artery pressure and thus lowers blood pressure. The American College of Cardiology and the American Heart Association recommends moderate to vigorous intensity physical activity for 40-minute sessions 3 to 4 times per week in a 2019 report. If finding 40 minutes at a time is difficult, there may be benefits to dividing the time into 3 or 4 10 to 15-minute segments throughout the day. Increasing your level of activity can be as simple as A. Using the stairs. B. Walking instead of driving. C. Gardening. D. Going for a bicycle ride. E. Playing a team sport. Simply do it on a regular basis and work up to at least half an hour of moderate activity per day. A 2014 review of exercise and blood pressure found that there are numerous exercise combinations that can lower blood pressure. Among these exercises are A. Aerobic exercise. B. Resistance training. C. High-intensity interval training. D. Short bouts of exercise throughout the day. E. Walking 10,000 steps a day. 3. If you are overweight, you should lose weight. Losing 5 to 10 pounds if you're overweight can help lower your blood pressure. You'll also reduce your chances of developing other medical issues. According to a meta-analysis of several studies, weight loss diets reduced blood pressure by an average of 3.2 mm Hg diastolic and 4.5 mm Hg systolic. 3. Reduce your intake of sugar and refined carbohydrates. Many studies have shown that limiting your intake of sugar and refined carbohydrates can help you lose weight and lower your blood pressure. According to one 2014 study, sugar, particularly fructose, may raise blood pressure more than salt. Sugar increased blood pressure by 5.6 mm Hg diastolic and 6.9 mm Hg systolic in trials lasting at least 8 weeks. A 2020 study comparing various popular diets discovered that for people who were overweight or obese, low-carb and low-fat diets reduced diastolic blood pressure by about 5 mm Hg and systolic blood pressure by about 3 mm Hg after 6 months. Another advantage of a low-carbohydrate, low-sugar diet is that you feel fuller for longer because you consume more protein and fat. Sugar increased blood pressure by 5.6 mm Hg diastolic and 6.9 mm Hg systolic in trials lasting at least 8 weeks. A 2020 study comparing various popular diets discovered that for people who were overweight or obese, low-carb and low-fat diets reduced diastolic blood pressure by about 5 mm Hg and systolic blood pressure by about 3 mm Hg after 6 months. Another advantage of a low-carbohydrate, low-sugar diet is that you feel fuller for longer because you consume more protein and fat. 4. Consume more potassium and less sodium. Increasing your potassium intake and reducing your salt intake can also help lower your blood pressure. Potassium is a 2-for-1 winner because it reduces the effects of salt in your system while also relieving blood vessel tension. Potassium-rich diets, on the other hand, may be harmful to people with kidney disease, so consult your doctor before increasing your potassium intake. It is simple to consume more potassium. Potassium is naturally abundant in many foods. 6. Stop smoking. It may be difficult, but it is worthwhile. Quitting smoking is good for your overall health. When you smoke, your blood pressure and heart rate rise immediately but only temporarily. Tobacco chemicals can raise blood pressure in the long run by damaging blood vessel walls, causing inflammation, and narrowing arteries. High blood pressure is caused by hardened arteries. Even if you are exposed to secondhand smoke, the chemicals in tobacco can affect your blood vessels. Non-smokers who could go to smoke-free restaurants, bars, and workplaces had lower blood pressure than non-smokers in areas where there were no smoke-free policies affecting public places, according to one study. 7. Reduce your stress levels. We live in stressful times. Workplace and family pressures, as well as national and international politics, all contribute to stress. It is critical for your health and blood pressure to find ways to reduce your own stress. There are numerous methods for successfully relieving stress, so find what works best for you. Deep breathing exercises, a walk, a book, or a comedy film can all help. Daily music listening has also been shown to lower systolic blood pressure. A 20-year study found that regular sauna use reduced the risk of dying from heart disease. A small 2015 study found that acupuncture can reduce both systolic and diastolic blood pressure.